Hi everyone. Tonight we're going to talk about something that might just save your future self a whole lot of grief. Picture this. You're sitting in that cold exam room again. The paper on the table crinkles under you, and the doctor casually says, "Let's just get a CT scan to be sure." Sounds routine, right? Well, maybe too routine. Because behind those smiling scrubs and sterile walls lies something we don't talk enough about. The quiet dangers of medical testing, especially once you hit 70. So, before you get comfortable, take a moment to like the video and subscribe. But only if you really like what I do here. And hey, tell me in the comments where you're watching from and what time it is for you right now. I always love seeing our little community spread across the globe. Now, turn off the lights. Maybe turn on the fan for some soothing noise. And let's get started tonight. Let's talk about CT scans. Yep, those big donut-shaped machines they slide you into like a DVD. You probably know they're used to detect internal bleeding, tumors, lung infections, pretty much the superhero of scans. But here's the twist. They're also stealthily loading your body with radiation. In fact, one CT scan can give you as much radiation as 100 chest X-rays. Yep, 100. And if you're over 70, your body isn't exactly bouncing back from those exposures like it used to. I remember the first time I had a CT scan somewhere around my mid-60s, when my back started acting like it wanted a divorce. They ran me through it just in case. Then again 6 months later. Then again the next year. No one told me those scans add up. No one told me that the cumulative radiation could increase my long-term cancer risk, especially for tissues already worn thin by time. And no, I'm not saying CT scans are evil. They're life-saving tools. But here's the kicker. They're overused. Doctors, out of caution or maybe fear of being sued, order them, even when the clinical need is questionable. And if you're a senior, it's easier to be on the receiving end of that just in case logic. There's even a heated academic debate about this. Should CT scans be rationed more strictly for seniors, or is the benefit still worth the risk? It's not settled. But many experts now agree fewer scans for older adults, especially if you've already had a few, might actually increase your longevity by keeping your DNA intact. And here's a quirky twist. Some hospitals actually own the CT machines themselves, meaning they earn money for every scan they run. Imagine a mechanic owning the car testing station. Suddenly, your vehicle needs a lot of tests, doesn't it? Old age wisdom moment. My grandfather used to say, if a man keeps checking his pulse, he'll eventually die of worry. He was talking about hypochondria, but in today's world of diagnostics, that worry can come with a radiation dose. So if your doctor casually tosses out, "Let's get a CT to be safe," don't panic, but do ask questions. Like, is there another way to get the same information? What would happen if we just waited and watched? How many scans have I had in the past 5 years? Sometimes, doing less is actually smarter. And if you've already had multiple CTs, don't beat yourself up. You didn't. No, neither did I. But tonight, you know now. And knowledge is what lets us age with grace and not just endure the system. So, here's your friendly reminder, wrapped in an evening breeze. Radiation doesn't knock, it accumulates. And past a certain age, your body doesn't need extra mysteries. It needs clarity, caution, and care. Now, let me take you back to something I thought was just a rite of passage after a certain age. The colonoscopy. Yep, that one. Everyone says it's necessary, especially after 50. And by the time you're 70, the doctors have practically memorized the prep speech. Just drink this, fast for a bit, will knock you out, and that's that. But here's what they don't always say out loud. After 70, it's not always as safe or necessary as we're led to believe. Now, I'm no stranger to this test. I had my first one at 63. I was nervous, of course, but the nurse told me, "Don't worry, you'll just sleep through it." And I did, or so I thought. The real surprise came a week later when my neighbor who's 75 told me she had a colonoscopy, too. But instead of feeling relieved afterward, she ended up in the ER with a perforated colon. It happens sometimes, the doctor said. A small risk, they claimed. But let me tell you, that small risk feels a whole lot bigger when it's someone you know. See, as we get older, the walls of our intestines become thinner just like the rest of us. That scope they use isn't exactly gentle. And don't even get me started on the sedation part. Older adults process those sedatives differently. Some bounce back in hours. Others, they spend days confused, dizzy, or groggy. It's a gamble no one tells you you're making. And here comes that academic debate we all love. Should routine colonoscopies be cut off at 75? Some researchers argue the risks start outweighing the benefits, especially if you've had previous clean results. Others push for continued screening just in case. Honestly, I think if your past tests were fine and you're not showing symptoms, maybe skip the Roto-Rooter treatment this year. Here's the quirky part. Did you know there's a movement, especially in Europe, towards stool tests as a safer alternative? No sedation, no poking around inside you, just a little sample in the privacy of your own bathroom. Now, I don't know about you, but anything that lets me keep my pants on and still checks for colon cancer, that's a win. And this is where old age wisdom really hits home. My aunt once told me, if it doesn't hurt and doesn't bleed, let it be. Not medical advice, obviously, but it's a reminder to ask whether we're doing things because we need them, or because they've become routine. One thing I learned the hard way. Just because your insurance covers something doesn't mean your body does too. They'll happily pay for as many colonoscopies as your schedule can handle. But if you end up needing help after a complication, that recovery time is yours to carry. Now, before anyone says I'm fear-mongering, let me be clear. Colonoscopies do save lives. They've caught cancers early. They've prevented tragedies. But they're not one-size-fits-all, especially past 70. And if your doctor recommends one, just press pause for a second. Ask, have I had clean results in the past? Is there a non-invasive option? What are the risks of skipping it for now? Because sometimes, not doing something is just as powerful as doing it. Let's not make fear our default. But let's also stop treating our aging bodies like they're still in their 30s. Respect them, protect them, and question what's really necessary. You only get one colon. Don't let it be a casualty of routine. So next, on the list, let's talk Mr. is specifically the ones with contrast dye. Sounds harmless enough, right? You lie down, they slide you into that humming donut machine, and boom, inside view of your organs, brain, joints, whatever they're hunting for. Except, here's the twist nobody wants to mention, that contrast dye they inject. It's not always so easy on your kidney, especially if you're over 70. I had my first contrast MRI a couple of years ago. It's routine, the technician told me. You might feel a little warmth, maybe a metallic taste in your mouth. Totally normal. Well, What wasn't normal was how sluggish I felt for the next 4 days. At first, I chalked it up to not sleeping well or maybe something I ate. But after the second scan, same thing. My doctor casually dropped the term contrast-induced nephropathy into the conversation, like it was no big deal. Here's the academic debate part. Some specialists swear the gadolinium-based dyes are perfectly safe, even in seniors. Others not. So much. Studies have started to show that this stuff can hang around in your brain and bones for years. Some countries have even banned the stronger versions. Yet here we are, in 2025, still casually sipping it through an IV like it's lemonade. Now, I'm not trying to freak anyone out. MRI is a powerful diagnostic tool. It saved lives, no doubt. But again, it's about balance. Especially when you're older and your kidneys have already been working overtime for decades. It's like asking your 20-year-old washing machine to clean heavy blankets every day. Eventually, something's going to give. Here's a quirky fact for you. Back in the 80s, MRIs were so rare, people used to line up for them like concert tickets. Now, you sneeze funny and someone hands you a referral. That's how normalized it's become. But with convenience comes complacency. And I think we've stopped asking, is this test necessary right now? So what do? We advocate. Before any contrast MRI, ask for a kidney function test, specifically your EGFR. If it's below a certain threshold, that dye might not be the best idea. And always ask, is there a non-contrast alternative? Sometimes the answer will be no, but other times you'd be surprised. My neighbor, Judy Shees, 77, had the same scan ordered twice in 1 year. It's protocol, they told her. But she pushed back, got a second opinion, and it turned out that the second scan wasn't going to give any new information. Saved her kidneys and probably $100 in Uber rides to old age wisdom moment. My grandfather used to say, a second opinion never made anyone sicker. And he was right. Doctors mean well, but they're also moving fast, juggling dozens of patients. Sometimes, it's up to us to slow things down. Now, let me paint a quick picture for you. Imagine lying flat in a narrow tunnel, wearing earplugs, the machine buzzing, like a microwave full of forks, and knowing you've just been injected with something that your body might not be too fond of. It's not exactly the spa experience. And if you don't need to do that to yourself today, maybe just don't look. If you've got symptoms like real red flags, go ahead and get the scan. No one's saying avoid care. But if it's just to be sure, and you've already had one recently, ask yourself, what am I hoping this will show? And what would I do differently if it doesn't? At our age, protecting what we already have is sometimes smarter than chasing what we might find. So tomorrow, if someone hands you an MRI slip, just pause, ask questions, and most importantly, listen to your body, because your kidneys, they're listening too. Let's move on to the next big one, stress tests. You know the kind. They slap electrodes on your chest, stick you on a treadmill, and tell you to walk like you're late for bingo. Sounds like a cardio checkup, but for some seniors, it turns into a game of medical roulette. I remember my cousin Earl. He's 74, hates exercise, but his doctor ordered a nuclear stress test just to be safe. The man hadn't run since 1983, but there he was, panting like a golden retriever in July. Halfway through, he felt faint. Not because of heart problems, but because he hadn't eaten that day. And the technician forgot to mention the IV contrast involved. He wound up needing fluids, not a pacemaker. This kind of testing is supposed to catch early warning signs of heart trouble. But here's where it gets interesting. The academic community is still torn over how useful stress tests really are. For people who don't have symptoms, one camp says it helps prevent heart attacks. The other asks, or does it just create anxiety and unnecessary follow-ups? The debate rages on. Now, here's an off-topic fact for you. Did you know the original treadmill stress test was invented by a guy who wanted to measure fatigue in soldiers? Imagine that, from combat boots to hospital gowns in just 60 years. Anyway, back to the point. Stress tests aren't evil, but they can be misleading. False positives are more common in older folks. Your heart might look like it's misbehaving on paper, but in reality, it's just adapting to age. So you end up down a rabbit hole of more tests, maybe even surgery, when really, you just needed to switch your decaf. I went through it myself. 3 years ago, my doc thought I had a murmur. Next thing I knew, I was jogging in Velcro sneakers, while a young nurse yelled, "Faster." I half expected Simon Cowell to appear and critique my performance. Spoiler alert, my heart was fine. But I lost 2 days of peace and a week of sleep. What's the takeaway? If you're having chest pain, dizziness, shortness of breaths, get checked. But if you're asymptomatic, feeling fine, and your last blood pressure reading was decent, take a breath. Ask your doctor if there are other ways to assess your risk first. Like a calcium score, test it's simpler. No treadmills, no dramatic soap opera pacing. And remember, testing doesn't equal prevention. Walking every morning, eating a bit less sodium, getting your sleep, that's real prevention. Not running like you're auditioning for the Olympics once every 5 years. Old age wisdom says, don't borrow trouble. And that applies here. Because stress tests, ironically, can cause a lot of it. I know one woman who started having actual heart palpitations after her test, not because of her heart, but because of the results letter that said abnormal, even though everything was fine. And here's a tip. If you ever get told to do a nuclear stress test, ask about the radiation dose. Some places use a higher dose than needed, and at our age, minimizing exposure is smart. We're already glowing from all those x-rays in the 90s. I know some people love tests. They feel reassured by numbers and printouts. That's fine. But tests without context are like checking the weather on 5 different apps. You just get confused and end up carrying an umbrella on a sunny day. So, if a doctor suggests a stress test, say, "Thank you. Can we talk about why you think it's necessary?" That one question might save you time, money, and a lot of treadmill-induced regret. And hey, if you do end up taking the test, wear good socks. Hospital ones are like slippery spaghetti. I nearly wiped out turning around for a blood pressure check. Bottom line, you're not a car that needs diagnostics every month. You're a person with experience, instinct, and a right to ask, is this really the best choice for me right now? Alright, next up let's talk about full-body CT scans. Ah yes, the modern crystal ball of medicine. You lie down, hold your breath, and the machine takes a high-res snapshot of, well, everything. Sounds magical, right? Catch cancer early, find hidden issues, feel ahead of the game. But here's the truth, no one tells you. These scans are not fortune-telling, and sometimes they dig up more anxiety than answers. Let me paint the picture. My friend Linda, 71, goes in for a preventive full-body scan, kind of like a health bucket list item. They find a shadow on her kidney, a blip on her lung, and a questionable spot near her liver. Her doctor sends her 4 more tests, then a biopsy, then a second opinion. Months pass, filled with stress and sleepless nights, and in the end, nothing, nada, all benign. She lost 12 pounds just from worrying. That, my friends, is what doctors call overdiagnosis. It's when you find things that would never have caused a problem, little scars, harmless cysts, or things your body already knows how to manage, but once they're found, you have to investigate them. That's the rule, and in older adults, the chances of spotting these little mysteries sky high. Now, academically speaking, the utility of full-body CTs in asymptomatic seniors is hotly contested. Some physicians argue they save lives through early detection. Others point to data showing no significant improvement in outcomes, just more follow-up scans, procedures, and yes, radiation. Speaking of radiation, this isn't like snapping a selfie. A full-body CT can expose you to as much radiation as hundreds of chest X-rays. At our age, that kind of exposure stacks up. It's not about being afraid, it's about being informed. You wouldn't sunbathe for 6 hours a day without asking a few questions, would you? Here's a quirky fact to lighten the mood. The first CT scan of a human brain took 9 days to process back in the 1970s. Now we get scanned and uploaded to the cloud faster than a TikTok dance. Look, I get it. The appeal of full-body scans is the same as reading your horoscope. It feels like control. Like if we just check everything now, we'll outsmart fate. But life's a bit messier than that. Some things are best left alone until they actually knock on the door. I had a doctor once say, "Don't go hunting for zebras in a field full of horses." Meaning, if you feel fine, your blood work is normal, and you're doing the daily walk around the block, maybe don't drop $2,000 and a wave of cortisol on a test that might just tell you your pancreas has a mole. Old age wisdom, it ain't broke, don't fix it. That doesn't mean we ignore warning signs, but we don't go borrowing medical drama either. So what's a better approach? Targeted testing. If you've got belly pain, get a scan of that area. If you're coughing weird, sure, chest scan. But a full body peek just to see what's there. That's a little like opening every drawer in the house just because one light bulb flickered. I know someone's probably thinking, but what if it does find something serious? That's always the tricky part. And sure, it's possible. But the chance that it finds something you didn't know you had and changes the outcome of your health journey significantly. Statistically slim, especially without symptoms. If your gut says no, listen to it. That's not fear, it's wisdom earned from a life of watching medical fads come and go. Remember when margarine was good for you? Exactly. And if your doctor really insists on the scan, ask, what are we looking for? What will we do differently based on the results? If they can't answer clearly, maybe that scan can wait, or not happen at all. Full body knowledge sounds like power, but it's often just noise. Don't let a picture of your insides take away peace of mind on the outside. Let's talk stress tests. Not emotional stress, although, let's be honest, a bad morning Wi-Fi connection can do that just fine. No, I mean cardiac stress tests. The ones where they strap wires to your chest, slap you on a treadmill, and crank up the speed like you're auditioning for a senior Olympics. These tests are supposed to check how your heart performs under pressure, how blood flows, if there's a blockage, if the OL ticker is up for the job. But here's something that shocked me when I dug deeper. If you're over 70 and have no symptoms, a stress test can sometimes do more harm than good. Let that sink in for a second. A lot of people, like my neighbor Dave, get these tests just to be safe. Dave's 74, fit as a fiddle, mows his own lawn, plays pickleball. One day, his doctor suggests a routine stress test. Just in case. Well, that turned into a mildly abnormal result. Then a dye test. Then a stent. Then complications from the stent. All for a heart that was, by all signs, perfectly functional. Before we started poking around. The debate on this is strong in the medical world. Some cardiologists argue it helps catch silent blockages. Others, often geriatric specialists, say we're creating cardiac patients out of healthy people. They argue that in older adults, unless you're showing real symptoms, chest pain, shortness of breath, it's often unnecessary. Here's the kicker. Your arteries will naturally stiffen a bit as you age. It's not always a biology. The body ages like old leather shoes, less flexible, a bit creaky, but still gets the job done. So if a test finds a minor blockage, it doesn't always mean your heart's about to give out. But once it's found, boom, you're on meds, undergoing procedures. Watching commercials about blood thinners during the evening news. Quirky fact of the day. The original stress test used stairs instead of treadmills. That's right. In the 1930s, doctors would have patients walk up and down actual flights of stairs to evaluate heart function. I guess Fitbit wasn't around yet. Now, I'm not saying ignore your heart. Goodness, no. But we need to ask why we're doing certain tests. Are they driven by symptoms or by fear? Because tests without context are like Google searching a headache and convincing yourself you have a brain tumor. Not helpful. Another old age wisdom nugget. Don't trouble until trouble troubles you. That's been true since my grandma was using baking soda as a miracle cure for everything from heartburn to rust stains. She also never trusted a test that required wires and a treadmill. But I digress. One more thing, stress tests aren't just treadmill runs anymore. There are chemical versions too. They inject you with something that simulates the effects of exercise, which sounds science-y and cool until you're sweating in a chair, heart racing like you just ran a marathon, wondering what possessed you to agree to this. If your doctor pushes for it, ask 3 simple questions. Do I have any symptoms that make this necessary? What happens if the test finds something? Will it change my treatment, or just cause more testing? If the answers don't make sense or sound like just to be sure, maybe you wait, or maybe you skip it. At 70 plus, our job isn't to chase every what if. It's to protect our peace of mind, our time, our sanity. I remember once overhearing a cardiologist say, "We treat numbers, not people." That stuck with me, because you're not a number. You're not a cholesterol score, or a treadmill speed. You're a whole person with wisdom, experience, and the right to say no. Listen, I'm not your doctor. I'm just the voice in your earbuds, whispering between sips of chamomile tea. But if you're feeling fine, walking fine, sleeping fine, maybe your heart's trying to tell you something. Like, relax, I've got this, and I don't know about you. But I'd rather spend my mornings stretching my legs in the garden than running toward a machine that's convinced I'm broken. Let's take a walk down the hallway of the last test on this list, the annual full-body CT scan. You've probably seen ads for it. Scan your whole body, catch disease early, peace of mind in 15 minutes. I mean, how could that not sound tempting when you're over 70 and trying to keep things running smoothly, right? But here's the truth, no one wants to plaster on a billboard. Full body scans can be more of a Pandora's box than a magic mirror. They might find something, or rather, they almost always find something. A tiny dot on your liver, a weird shadow near your spine, a harmless cyst in your kidney, and once they find it, you're in the system. More scans, more stress, possibly even surgery for something that never would have caused you harm. A few years ago, my cousin Linda Sharp, as ever, at 72, went in for one of these peace of mind scans. She walked in, healthy and smiling. A week later, she was stressed beyond belief over an area of concern in her lung. They told her it was probably nothing. But maybe it wasn't. Biopsy followed. Infections followed. Turns out it was nothing, just age spots on her lungs. But her confidence, shaken, her body, bruised, her wallet, lighter now. Don't get me wrong, technology's amazing. We've gone from X-rays to 3D imaging, to machines that practically whisper to your organs. But just because we can see everything doesn't mean we should. One of the core principles of medicine, especially in older adults, is to avoid what's called overdiagnosis. That means catching things that technically exist but don't pose any actual threat. It's like calling pest control because you saw a butterfly in the garden. A lot of doctors will argue that more information is better. What if it's cancer? They'll ask. And sure, sometimes it is. But most of the time, especially in seniors, it's not. And even if it is, slow-growing cancers in the elderly often don't require aggressive treatment. Sometimes, they're better left alone. Quirky fact. The first CT scanner was developed in 1972, and it could only scan the head. It took hours. Today, a full body scan takes minutes, but the psychological fallout can last months. Welcome to progress. Don't you know what my grandmother used to say when someone panicked over a new test or scan? The more you dig, the more worms you find. I used to laugh, but wow, she wasn't wrong. There's also radiation to consider. While a single scan won't turn you into the Hulk, repeated exposure, especially when not truly it's low risk, sure, but low risk plus low benefit. That's not a winning equation. It's like insuring your house for alien invasion. Technically possible, practically ridiculous. Here's an old age wisdom fact I live by. Just because something is free or offered with good intentions doesn't mean it's good for you. Free donuts at the bank. Bad idea. Free scan from a mall kiosk. Worse, by the way, did you know CT scans are one of the top revenue generators in private medicine? Some clinics are essentially marketing machines, not health institutions. That's not cynically, it's just business. They need you to worry, so you come back. Worry sells, so what do we do instead? We go back to basics. Trust how you feel. Stay active. Eat real food. Get checkups based on symptoms, not fear. If you're curious about something, sure, ask your doctor. But remember, peace of mind isn't always found in a machine. Sometimes, it's in skipping the scan and sipping tea on your porch. We've earned the right to be a little skeptical, to pause before putting our bodies through a medical carnival ride just in case. After 70, our time is more valuable than ever. Our energy more sacred. Our dignity absolutely non-negotiable. So the next time someone offers you a shiny new test just to be sure, smile politely, thank them for their concern, and walk away strong, steady, and wiser than ever. Asterisk good night.